like to welcome Dr. Ben Keenlyside, who is a physicist working in the medical school here in Birmingham on photoacoustic imaging. And I'm going to hand over to Ben.
Hi, yeah, thanks for that. So yeah, as you can see, I'm going to be talking about an imaging technique called photoacoustic imaging, which is a medical imaging technique you may not have heard of. And to give you a little bit of a preview of what we'll be talking about today, photoacoustic imaging is what produced this image you can see here. So I'll be talking about how we can use this idea of light and sound and combining these to create images like this one of vasculature inside a human hand. So in overview, to give you an idea of what I'm going to talk about, I'll first talk about medical imaging just a little bit more generally, about what's already out there and about what the kinds of things you need to think about in medical imaging are. I'll then talk a bit more about the power of colour, about how colour is a really powerful way of getting information about things and why we would want this for imaging. Moving on then, I'll then talk about this technique specifically, photoacoustic imaging, this idea of creating sound with light and using that to create images inside the human body and how that allows us to access the power of colour for medical imaging. I'll then go in a little bit more detail about what we need for photoacoustic imaging, not just to work, but to work well, to talk about the sensors that are involved in this technique, and then move on into kind of a little bit of a whistle-stop tour of some of the emerging applications of this technique, the areas that this is being explored to benefit patients, as well as some of the frontiers and how we're trying to make photoacoustic imaging better for the future. So, medical imaging. I imagine that most of you have come across at least some kind of medical imaging before, and there's a variety of these. There's things like X-rays, where we shine X-rays through the body and use that to form images, usually of quite dense structures. So that's why it's often used for things like imaging the skeleton, looking at things like fractures inside the human body. Magnetic resonance imaging, by contrast, is really good for soft tissues. It allows us to image all the way through the human body and see soft structures. And that's why it's used for things like assessing the state of the brain. For example, if you hit your head, you may get an MRI to work out if you have damage in the brain, or for things like looking at the state and location of cancers. Ultrasound is probably most famous for being used for fetal imaging during pregnancy, and this is a technique where we transmit sound into the body and we look at the reflections coming back out of that and use that for imaging. But this can be used for a number of other things. So one of my favourite examples here is this image here, or video in fact, of a human heart beating inside the body, where you can see the valves flapping as the heart beats. Finally, all of these have actually been around in one form or another for quite a while, but a more recent technique is optical coherence tomography, or OCT, and this is used for looking at optical information in the back of the eye most often, so you tend to find this kind of thing in an optician's. This isn't an exhaustive list, but these are some of the most major kinds of imaging out there. And they've all got similar kinds of concerns you need to think about when you're trying to work out what kind of imaging is appropriate. The first of these, I'm going to say, is contrast. This is answering the question, what is it that I can see? In order for us to form any image, we need to be able to see differences between things, and this is what contrast is. For medical imaging specifically, then, we also want to think about depth. Generally speaking, for medical imaging, we want to not have to cut open the body to look inside. We want to be able to do it completely non-invasively. And so for this, the real question is, where can we image? Are we able to image all the way into the body, or does this need to be quite near the surface? We've got two more concerns that I'm kind of grouped together into when should we image. So this is safety and cost. So for some imaging technique, there is a safety trade-off in imaging. So for example, in X-ray imaging, some kinds of X-ray imaging, there's a relatively small risk, but there is a risk nonetheless from ionizing radiation. So you don't want to be doing this all the time. You wouldn't want to be wanting to get an X-ray every day of your life. And in a kind of similar vein, but in a very different kind of consideration, something like magnetic resonance imaging requires very large, expensive machines. That means it tends to be something that's going to be done in a hospital, rather than a GP clinic down the road. And both of these are answering this, when can we image? But I want to really zero in on this idea of contrast. What can we image? Because this is kind of the most fundamental, I'm going to argue, that before you can worry about all of the rest of those things, you need to have a way of seeing something. So to illustrate this, I'm a physicist, so I'm going to start with my spherical patient here. If my imaging technique gives me no contrast, I can't learn anything about my patient. With no contrast, I get no information. If I have some source of contrast, some way of telling the differences between different things, I might be able to reveal something. So here, my spherical patient has got these three spherical structures inside them. And when we have strong contrast, like in this example here, it's very easy for us to see what's going on. Whereas when we have weak contrast, I don't know if you can even see it on this slide, but if we have weak contrast, it's much harder. So we want our contrast to be strong. Moving beyond that, we may in fact want multiple sources of contrast. So the example I've given here, of course, is the one I'm going to be talking about with colour. So we want multiple different kinds of information, and that often tells us more than the sum of its parts. So for example, if we had an MRI image and an X-ray image, they each tell us something different, and that combination might make it much more valuable. But if we can't do that, what we may want is specific contrast. So in this example, we got some information about all of these structures, but let's say maybe this top structure, maybe this isn't an organ after all, maybe this is a tumour, for example, in which case it's really, really important that we know where it is and if it's there at all. So in that case, we want our contrast to be really specific to the thing we're looking for. We want the right information. It's important that we see this here and we know what it is, rather than getting it mistaken for these other objects. So the thing I want to take away here is that we really want two things from contrast fundamentally. We want it to be strong and we want it to be specific. Beyond that, if we can, we might want lots of kinds of contrast, but first we need it to be strong and specific. And colour is a really powerful way of doing this. So to give an example of that that's sort of familiar from everyday life, here I've got two images of leaves in grayscale, and we've already got some contrast here. We can tell that these are leaves, we can see where their boundaries are, we can look at their shapes. But if I told you that one of these leaves is from the summer and that one of these leaves is from the autumn, you may find it difficult to tell which this is from a grayscale image. Whereas when we add colour, that's much easier to tell. We can see that this leaf is green, we know it's from the summer, we've got some information there. This is orange, this is an autumn leaf. And this is what colour can do in human vision. Of course, colour can go far beyond human vision if we slightly relax our definitions. What we can see potentially is from the blue to the red range of the visible spectrum, but light waves go way beyond this. We've got, while we're still talking about something that we're going to call light, we've got ultraviolet and infrared, and the information here is still going to let us get things out. So for example, whether something absorbs infrared or ultraviolet light lets us get information that we wouldn't be able to see by eye. And we can also get much richer information by making more measurements than what the human eye does. So all of the colours that the human eye can see are made up from us detecting blue, green and red. Whereas if we're making measurements electronically in a different way, we can look at far more than this. We can look at a lot more than 3 channels. So a nice example I like of this is a series of different spectra of different molecules. And each of these essentially gives us a fingerprint of these molecules, where these peaks are, what the wavelengths of these peaks are. So for example, by eye, I don't imagine that any of us could look at a coffee and tell if it was caffeinated or decaffeinated. But in theory, if you looked at the spectra, you might be able to tell that just from the colour of the light. And this means that colour is used in imaging all over the place, in loads of areas of physics and medicine. So as a nice example of some pretty images, here we have the sun in different wavelength bands, looking at different colours of light. So on the left-hand side, we have something that's quite closely matched to what we would see by the visible light. And then as we move across here, we're moving further and further into the ultraviolet. And we've got different information being revealed. So on the left-hand side, we can see we've got these sunspots here, but all the way in the far ultraviolet, we're getting information about the atmosphere of the sun, of these very hot areas beyond its surface. So colour can be useful here. And this is, of course, true in medicine biology as well. So one of the biggest examples you would find in the clinic is histopathology. This is where, for example, if a patient has a cancer removed, a tumour removed, and we want to be certain that it's actually gone, what we would take is a small sample of tissue, dye that with a number of different dyes that attach to different parts of the body, showing up things like these purple region here, cell nuclei. And if you're a doctor that's trained in histopathology, you can interpret this and work out, okay, have we got the edge of the tumour? Do we know what's going on? And all of that's got from colour that's been labelled onto these thin samples. Similar kinds of ideas are used in biology. So this is a fluorescence microscope image where different fluorescent molecules have been used to tag different parts of the cell. So this central blue region here is the nucleus, and this green region is telling us something about the structural proteins involved in the cell. And we don't have to label things to find this kind of stuff out. Colour is already present in the human body to give us information. So one of the examples that will turn out to be really relevant in the rest of this talk is the difference between venous and arterial blood. So over here, this is blood that you'd find in a vein. This is deoxygenated blood, which has this dark red colour, whereas blood from an artery, oxygenated blood, has this very, very bright red colour you can see on the right. So just by looking at the colour, we're learning something about the blood here. But we do have a problem, and that's that human beings are not transparent. We can't, just take cameras of the inside of a human body without cutting something up. And to help illustrate this, my colleagues have graciously sent me this photo of the back of my head, where you can't see the slides through the back of my head, or indeed the inside of my head. But the reason for this is not actually because human beings are completely opaque. We're not transparent, but we're not completely opaque either. So to demonstrate that, if I take my torch, my phone, I shine it through my finger. I don't know how clear this is at the back, but you can see some light through my finger. So we're not completely opaque. So why is it then that human beings aren't transparent? And it really comes down to light scattering. So when we transmit light into the human body, rather than taking nice straight paths like it does in free space, it's scattered all over the place, it becomes a complete mess, and we can't form a clear image. And that's the thing that really dominates this non-transparentness. So we can get light in, we just can't form an image properly. How can we solve this? Maybe one idea we could have is, what if we combine sound and light? You already saw it in the start of my talk, but is there some way we can combine the benefits that we get from ultrasound, that this can get really deep into the body and form images, with all of this really powerful contrast from light? Can we take the fantastic contrast of optical imaging, but overcome this depth limitation by combining it with ultrasound imaging, where we get very, very deeper into the body, but we have much more limited contrast? How would this work? And the way we can do this is, like you may have guessed, photoacoustics. This relies on a thing called the photoacoustic effect, which is if we get something that absorbs light and we illuminate it with a very short pulse of light, what we get is the generation of an acoustic wave, of an ultrasound wave. The mechanism for this is that when light is absorbed, it produces a small increase in temperature. On a sunny day, you can feel that you get warm. So if we send a very, very short pulse of light into a person, we'll get this very quick, tiny increase in temperature. That'll produce an increase in pressure, and then that will travel away as an ultrasound wave. And actually, this effect has been known for a really long time. So this was originally discovered by Alexander Graham Bell, the inventor of the telephone, back in 1880. And the way this was discovered was that the sunlight was filtered through this spinning disc with some holes in it, so the sunlight was essentially turned on and off very, very quickly. And when that illuminated something that absorbed sunlight, it produced a sound that he could hear. And on discovering this, he wrote this rather lovely letter, I think, to his father, saying, "I have heard articulate speech produced by sunlight. I have heard a ray of the sun laugh and cough and sing. I have been able to hear a shadow, and I have even perceived by ear the passage of a cloud across the disk of the sun." But it wasn't until much more recently that we could use this for imaging. So this effect has been known for a really, really long time, but it was only much more recently that we could use this for imaging. In fact, without getting to the developments that caused that, I can demonstrate this here. So we'll have to see how well all of you can hear, particularly at the back. If anyone's interested, I can show later. But if I take this can, which absorbs some light, you can see it, and I illuminate it with a short pulse from a camera flash. So just to warn everyone, there will be a flash of light. If we're all very quiet, we may be able to hear the sound. Don't know if you could hear that. I'll give it another go. We heard a short ping there, and that was sound created just by light, by the absorption of light in that can. So this effect has been known for ages, but we've only been able to use it for imaging quite recently, and that's really because of advances in the development of the laser as well as computational methods. So how do we take this effect? How do we take this ability to generate sound using light and use it to form images? So the basic idea here is, rather than just any old absorber, we take the human body, we take something in the human body that absorbs light, and very often that means blood. The hemoglobin in blood absorbs light quite strongly, so we can use that. And then we place in contact with the body a whole array of ultrasound detectors, like you would use for ultrasound imaging. And from that, we can then detect the ultrasound waves that are generated by the photoacoustic effect and form images like this one. In a little bit more detail, I can illustrate this in an example here, where we've got this region here, which I'm going to say is some tissue down to a depth of a few millimeters. Across the surface of the tissue, so at the skin, we've got an array of these ultrasound detectors. And then inside the body, we've got a few things that absorb light. So this could be a blood vessel, for example. If we then illuminate that with a very short pulse of laser light, so typically we use pulses of about a nanosecond, so a billionth of a second, we'll get this very short increase in temperature, pressure, and an ultrasound wave. And that will travel away from our source, away to our detectors where we can measure it. Great, okay, so we've measured these ultrasound waves, we've got a whole load of ultrasound measurements at different positions along the surface. How do we use this for an image? And what we can then do is we can play these back in time computationally, so we take an acoustic model in a computer, we reverse time in that model, and we have these waves travel back from the sensor to where they were originally generated. And in this way, we get an image which shows us all of the regions that the acoustic waves originated from, which is where the light was absorbed. So what we've got is this computational reconstruction of light absorption inside the human body. So we can image anything that absorbs light. What this gives us is an imaging technique which gives us this really strong and specific optical contrast, this ability to look at the absorption of different materials, for example, oxy and deoxyhemoglobin in blood, or lipids, fatty molecules that we find in the body. These have got a different absorption spectra, they'll absorb light at different wavelengths, and so we can image different things inside the body with this strong specific contrast. It, of course, gives us this ultrasound depth and resolution, like I've been talking about, this ability to image inside the body because ultrasound waves can travel through tissue without being scattered so strongly. It's safe and non-ionizing, so the lasers that we use for this are sufficiently low power that there's no risk of damage to human tissue. So unlike something like X-ray imaging, we're able to image as much as we want. And this means that imaging can be a whole load of things. We can look at structures in the body, like blood vessels or clusters of cells. We can spectroscopically tell the difference between those structures, so by looking at differences in their absorption, we can tell what's going on there, and that lets us do functional things, like trying to measure the oxygenation of blood inside the body. It can also be longitudinal, and what this means is that we can image over many, many times over days or weeks, for example, to look at how some part of the body responds to a treatment. Because this is safe and non-ionizing, we don't have to worry about only doing a single image, we can do this multiple times. And what this gives us is images like the one I'm showing you here. So this is an image of blood vessels inside the whole human hand, rotating, so you can see this three-dimensional volume we've imaged. Here the colour is false colour, so these blue and green vessels, it's showing that they're near the surface, and the red vessels are deeper down. So this is great, we've got these really detailed images. And for this reason, this has been a really growing field. So this was started in the 1990s, but the amount of research in this field has been growing all year by year, and it's now crossing the barrier to commercial devices, so that people can purchase these devices and try to use them to understand where can we get this to clinic, how can we benefit patients. Okay, so to summarise what I've told you a little bit again, I've talked a little bit about medical imaging and particularly emphasised this idea that contrast is really important. I've then said that colour is a really powerful source of contrast and talked about how in photoacoustic imaging we can access that information, we can access colour inside the human body by generating sound with light. Unfortunately, it's not quite as simple as I've presented it there. It's not quite as easy as just getting an ultrasound detector, strapping a laser to it and getting images. So I'm going to talk a little bit now about the technology of photoacoustics, specifically sensors. In that, I'm going to spend a little bit of time talking a bit about how we can not only generate sound with light and use that for imaging, but we can also detect sound with light using these optical ultrasound sensors that are really well suited for photoacoustic imaging. And then after that, like I said, I'll give you a bit of a tour of the applications that are emerging, as well as some of the frontiers. Okay, so why is it that we can't just take an ultrasound transducer, the kind of thing that you would already find in a clinic, and strap a laser to it? So if you take a simple system like this and you use it to form an image, what you get doesn't always look great. So here is an example here, where in grey we've got an ultrasound image, and then these coloured channels are showing the distribution of different nanoparticles inside a tumour that's being studied. And there's some information, you can see that this yellow band, that's presumably one of these nanoparticles, you can see it seems to be in the margin of the tumour. We can then see something maybe about the distribution of these other nanoparticles, but it's pretty difficult to see things here. This isn't like the images I showed you previously that are really detailed. And why is that? Well, the reason for that is because what we need from an ultrasound sensor for ultrasound imaging and for photoacoustic imaging is quite different. So what do we need? We need our detectors to be really sensitive. The reason for that is that unlike in ultrasound, photoacoustic signals are really very weak. It's a very small increase in temperature inside the body, so we get quite a weak ultrasound wave. Even more than that, if we want to image deeper, we need to be really, really sensitive. And to illustrate that, I've got an example here where I've got a bowl of detectors, I've got some bit of tissue, and I've got photoacoustic sources at different depths. And on the right-hand side, I'm showing you the ultrasound waves that we would record in that situation. So from the photoacoustic source, the light absorber near the surface of the tissue, we get a relatively strong ultrasound wave. But if we look at the ultrasound wave from this deepest source, you may not even really be able to see it. We've got this very, very weak ultrasound signal. So if we want to image deep inside the body, we need really, really sensitive detectors. And to give you an example, I'm going to return again to my spherical patient. Here I've got my spherical patient with a few different organs. I've got this granular one, maybe that's an indicator of some disease. And I've got two different structures here, one of which is hollow and one of which is filled in. Maybe that's an important thing we need to know. If we had a sensor that was too low sensitivity, we're going to get this really grainy image, which means we start to lose features deeper down. So as we have a worse and worse sensitivity, we'll get more and more limited in what we can see. Right, we want a sensitive detector. Great, what else do we need? We also need it to be broadband. And what I mean by that is we need it to be able to detect both very low frequencies of ultrasound and very high frequencies of ultrasound. So if we take a detector that can't detect high frequencies, what we get is a very blurry image. If we lose high frequency ultrasound, we lose our resolution, and that means that we can't see much. In this example here, this granular structure here has already disappeared. We can't tell what's going on. In fact, this point about high frequencies giving us a higher resolution image is why we need to use ultrasound in the first place. If we were to use the kinds of frequencies that we can hear, so the limit of human hearing is usually taken to be about 20,000 kilohertz, so sounds that are oscillating 20,000 times a second. In that situation, the resolution limit you've got, the minimum distance between two things that you could tell apart by hearing, would be about 2 centimeters in air and about 10 centimeters in water, which give you a pretty rubbish image. Whereas for ultrasound frequencies, which are typically in the range of sort of 1 to 10, maybe all the way up to 100 megahertz, so millions of times a second, we get resolutions that are on the scale of millimeters down to a few tens of microns, micrometers. So we want these high frequencies. But like I said, we don't just want these high frequencies, we want the low frequencies too. And that's if we lose the low frequencies but keep the high frequencies, we lose the interiors of all of our structures. We get an image that looks like this. I'm not sure on this projector how clear it is that you can see anything actually, but what we get left with is just the edges of our objects. So we can't tell the difference between this hollow shape here and this filled in one. We get a very badly distorted image. For similar sorts of reasons, we want to be able to detect sound waves coming from any direction. So if we can only detect sound waves coming really straight onto our sensor rather than from lots of directions, our image will get badly distorted. We only see the tops and bottoms of surfaces. We lose the edges of everything, and the image is very hard to interpret. Finally, we want our detectors to be small and scalable. We want to be able to make many, many very tiny detectors. And these are kind of bound up in these previous points, but to kind of give you a simple illustration, if our detectors are very large, again, that's going to lead to a loss of resolution. And if we've only got a very small number of them, we might not be able to image very much. We'll get a very limited field of view. And this means that imaging with the right sensor is really important. If we have a sensor that does all of this quite badly, we get an image which shows us almost nothing. Whereas if we have something, it's not perfect, but if it's a lot better, we can clearly see all of this stuff comes back. We get these granular structures, we can see that this is hollow and that this isn't, we get the information we want. So we need a detector which is sensitive, broadband, omnidirectional, and small and scalable. If we look at the existing technology, most acoustic sensors for this kind of work are called piezoelectric sensors. These are quite well established, and this is what will be used to image if you get a normal ultrasound image. The way these work is we have small crystals, and when a pressure is applied to these crystals, it produces a voltage which we can measure to get acoustic signals. If we want to then image, we just get a series of these, put them together in an array, and you get a probe that looks more like what you might be familiar with. You can do a lot better than the image I showed you earlier with photoacoustic imaging. You can produce relatively good photoacoustic imaging systems using piezoelectric transducers, but they do have fundamental trade-offs. In particular, if we want to make a piezoelectric detector really, really sensitive, that tends to mean that we have to make it sensitive only to a narrow range of angles or to a narrow range of frequencies. An alternative that we work on quite a lot is optical ultrasound sensors. So this is a sensor that in fact can be made transparent and that meets the requirements of photoacoustics much more closely. And the way that these work, I'll talk in more detail, but the very basic message here is we have this very, very thin layer of a polymer, of a plastic, and we can detect the thickness of that layer really, really accurately. So when that layer is squashed or stretched by a sound wave, by detecting that change in thickness really accurately, we get a really accurate measure of the sound wave. So to talk about these a little bit more, let's think about how they work. How are we able to detect sound using light? In structure, like I said, these sensors are formed of this thin layer of a polymer with a pair of mirrors on either side of that. And to read out one of these sensors, to make a measurement, we take a laser beam, we point it at some small region of this sensor, and the light then bounces back and forth inside the cavity. What we do to get a measurement out then needs a little bit of an explanation of the physics involved here. So if we transmit light into one of these sensors, it'll have some wavelength, some number of oscillations over a distance. And if that number of oscillations matches a whole number inside the cavity, the light will be transmitted through. So when we transmit the right wavelength of light into this cavity, it's transmitted. Any other wavelength where it doesn't match is going to be reflected. And that means if we change the thickness of one of these sensors, we will change what is reflected and what is transmitted. So we could look at differences in what's transmitted through the sensor, what's reflected from the sensor, to measure its thickness accurately. This is the same kind of physics that gives colour to soap bubbles or to an oil slick. So if you look at this image of a soap bubble here, you can see lots and lots of colour differences. And part of what gives it that is that we're looking at differences in thickness of the outer layer of this bubble. In regions where we see blue versus purple, for example, we're seeing a different thickness of the bubble. So you could imagine that in theory what we could do then is we could take a white light source, we could point it at one of our optical ultrasound sensors, and by looking at changes in the colour of the light being reflected off the sensor, maybe we could measure changes in its thickness and acoustic waves that way. It turns out that's quite an impractical thing to do, so what we do instead is we take the change in the reflectivity of light off this sensor as a function of wavelength. So we've got this colour here, which is very well transmitted through the sensor, so therefore is not reflected. And we point a laser at it very close to this, but not quite on it. And what that means is that the amount of light reflected back off the sensor will change when the thickness of the sensor changes. So to illustrate this, if this sensor was being insonified by a sound wave, if a sound wave was pointing at the sensor, we would see this fringe shifting back and forth, and the amount of reflected power would create a copy of the acoustic wave. So in this way, we turn an acoustic signal into an optical signal, and those are much easier to measure. And these can be fantastically sensitive. In fact, this sensor here from our lab that I'm showing you, we can detect using a sensor like this a change in its thickness of about the radius of a single atom. And this kind of physics is actually used all over the place, this idea of looking at changes in the different distances between mirrors and measuring differences in reflected light to detect all kinds of things. So in our sensors, we have a layer, this polymer layer, this plastic layer, which is about 1/50th of a millimetre thick, and we use it to detect acoustic waves. But on a very different scale, the LIGO detector, which is used to detect gravitational waves travelling through the universe, has a pair of mirrors at either ends of this facility, separated by a distance about 4 kilometres. But it's the same kind of physics going on here. We're still just measuring the distances between a pair of mirrors and using that to measure some signal. So that tells us how we measure ultrasound wave at one point. We point a laser beam at one of these layers. We can measure its thickness very accurately, and so when an acoustic wave changes that, we get a change in the thickness that we can detect. To form an image then, what we do is we scan a laser across the surface one of these sensors, and we make acoustic waves at every position that the laser beam is pointed at in series. And what that gives us is one of these ultrasound arrays I talked about earlier. And using that, we can get images like the ones I'm showing you here. So this is a tumour and vasculature. Another example of the vasculature in a tumour, and then a kidney cell here where we can see the blood vessels. So we're getting these really detailed high-resolution images. Because optical sensors give us this large bandwidth, this omnidirectionality with these small number of sensors, we can produce these really, really high-resolution images. But there is a bit of a problem with a system like this, which is it takes several minutes to form an image. And having done this myself, I have to say it's a bit of a pain if you have to stay perfectly still for several minutes. You'd really rather it was done more quickly than that. The way we solve that is we add more laser beams. So rather than just reading this sensor by taking one laser beam and scanning it around the sensor, we take 64 beams, we scan all of those around at the same time, and that means that an image that would have taken a few minutes to acquire is instead acquired in a few seconds. So the imaging system that does this is at University College London, shown here. This big trolley here is the excitation laser used to generate the photoacoustic waves. This trolley here is all of the electronics used to detect the signals coming back from each of these 64 beams. And this tiny thing here at the top is the actual sensor, mounted on an arm so we can move it around and point it at different parts of the body. So you can see here, you can bring this to image anywhere on the body. Okay, so that's a bit about how we do photoacoustics in practice, how we've got these optical ultrasound sensors that give us a way of getting really high-resolution photoacoustic images. What do we actually do with that? One of the things that this is very good for is imaging blood vessels. So because blood is quite strongly absorbing, we can form images of blood vessels very accurately, very high resolution. Some examples from a healthy volunteer here, where these are photoacoustic images taken at the tip of the finger and in a palm. And these are three-dimensional images that I'm showing you from two different perspectives. So this here is from the top down, and these images below are from the side, where you can see the three-dimensional image down to a depth of about 1.5 centimetres. Again, we've colour-coded these so that the yellow and red vessels are near the surface and the greener vessels are deeper. And what you can see here is these really, really detailed images of blood vessels. In fact, we can even see things like the valves that you have on your veins that stops blood flowing in the wrong direction. So this here is a cross-section through a single blood vessel, and you can see this structure here, which is the valve in a vein, which keeps your blood flowing the right way. And we can do this in loads of different places. One of the images I particularly like is this image of a human tongue, where we can see this hierarchical set of branching vasculature. We've got these larger blood vessels at the bottom, which branch into smaller and smaller blood vessels as we reach the surface of the tongue. We can also speed up this kind of imaging to get things that are more video rate things by either looking just at slices or by taking smaller images. So this is an example here where the scanner is being kept on a part of a human arm, and you can see there's a signal here from the skin surface. I don't know how clear it is, but we've got this circular structure here which is beating, and that's in fact a live video of somebody's heartbeat as their radial artery beats in time with it. We can do the same thing in 3D at slightly lower frame rate, so at 2 or 3 frames a second, we can move one of these sensors around and get a live view of blood vessels in the human body and see exactly what's going on under the surface. And for this reason, we can image dynamic processes. So this is a thing called a cuff occlusion, where we take a high-pressure cuff, like you'd use to measure blood pressure. We use that to restrict blood flow to the arm, and then when you release it, you can see in this image the blood rushing back through the vessels, and from this we can find out information about blood flow, about where it's going to first, how quickly it's moving, things like that. Moving on from these kind of examples with healthy volunteers, there's also a lot of work going on now on trying to explore the best suited places for this clinically, about where this can benefit patients. So imaging vasculature, there's a whole load of regions this could benefit. Things like assessing the state of burns by looking at vessels below the surface, looking at vascular networks, what their shape is, whether that can tell us things about things like arthritis or peripheral vascular disease, as well as things like cancer. And I'm going to focus on one example from each of these 3 to kind of give you a bit of a flavour of photoacoustic imaging as it moves towards the clinic. So in inflammatory arthritis, this gets a stiffening of the joints, and part of what's going on there is that we get this thickening and blood vessels growing into the area around the joint between the bones. So if we take photoacoustic images of joints that are affected by arthritis versus unaffected, we can immediately see that difference. In this unaffected joint on the side, this is a side view, you can see this central region has got no signal. We've got no blood vessels there. Whereas in the affected joint, we can see the signs of inflammation, these blood vessels that are growing into the joint. And using this, we can try to do things like assess the severity of arthritis to maybe work out what treatments may or may not be effective. In a similar vein, we can look at the morphology of vessels, how the vessels are shaped to assess things like peripheral vascular disease. So this is a disease that is associated with poor perfusion, that's poor blood flow, and in the most extreme cases, this can lead to limb amputation if it's not treated early. The difficulty is that the signs of this disease early are in the very small vessels, which are quite hard to image in other imaging techniques. So if we take a photoacoustic image and we compare a healthy region from an unhealthy region, we can see that we get these small blood vessels that start to develop this sort of twisted, tortuous shape. And that's telling us signs that this disease is affecting this area. And hopefully we can use this to pick up diseases like this earlier. A similar kind of thing can be done in diabetes, which in severe stages can affect the shape of the blood vessels as well. So again, in the healthy case, we've got these sort of smooth, straight blood vessels, and in the affected region, we've got these twisted blood vessels that are starting to show the signs of disease. So this might give a way of determining the staging of things, working out how severe disease is. Like I discussed at the beginning, we can also do longitudinal imaging. We can look at how something responds to a treatment by imaging at multiple time points. So in this example, we're looking at how a tumour responds to a drug. So here we have an image of the tumour before treatment, where you can see this sort of blobby structure in the middle. This is the tumour. Then after treatment is applied, this is a treatment that's designed to destroy the vasculature inside the tumour and therefore kill it. We can see the centre of the tumour goes dark. We have successfully killed the centre of the tumour. However, unfortunately, as you can see over this progression of images over the span of a few weeks, the tumour regrows in from its margins back towards the centre, and that means that unfortunately this isn't an effective treatment for this kind of cancer. Okay, so that's a little bit of a sampling. I could talk a lot more about this, but to kind of keep things moving, I'm now going to talk a bit about something a bit different. So one of the big frontiers in photoacoustic imaging now, having got this more established, is trying to tackle these problems of, how do we take this imaging technique, how do we apply it to specific diseases? But there's also lots of work going on in improving the technique fundamentally and improving how high quality the images we can get are. So one of these frontiers is imaging depth. And like I described earlier, imaging depth is really intimately related to how sensitive we can make our detectors. If our detector is a lot more sensitive, we'll be able to see things further into the human body. So one of the questions is then, okay, how can we make our detectors more sensitive? If we have one of these optical sensors, then to some extent you can say that the sensitivity of one of these is related to the number of times that we can get light to bounce back and forth inside this cavity. If we can get it to bounce back and forth a very large number of times, we're sensitive to very, very small changes in the thickness. One of the limitations on this kind of sensor, where we've got these flat mirrors that are parallel to each other, is that as the beam travels back and forth inside the sensor, it slowly spreads out. And this means that eventually light starts to leak out of the cavity. How could we fix this? Well, one way of fixing this would be to change the shape of the cavity. Rather than having a pair of flat mirrors facing each other, we could have one flat mirror and one curved mirror. And that would mean that each time light travelled back and forth inside the cavity, it would be refocused back to exactly its original path. And that might mean that we could have the light travel back and forth a much larger number of times and produce a more sensitive detector. So sensors like this were made. So this is an image of one of these sensors, which is, again, a polymer layer, but in this case, rather than having two flat mirrors, we've got one of these curved mirrors. These are fabricated by this nice system shown here. So what we do is we take droplets of a liquid polymer and we release a very small amount of this onto a flat surface. What that means is that surface tension then gives us this perfect domed surface. We then, of course, don't want them to stay liquid forever. So what we do is we use a UV curing. This is the same kind of thing that you would use if you had an ultraviolet curing glue that sets when exposed to ultraviolet light, to take all of these individual little liquid domes and set them so that they become a solid polymer. After that, we can deposit a mirror on their top surface, and so we end up with a flat mirror underneath and a set of these curved mirrors above these droplets. What was found then when this was done is that this does in fact improve their sensitivity. So don't worry too much about what's on our x-axis here, but on this y-axis is essentially a measure of the minimum, the smallest acoustic signal that we can detect. This red line at the top here is showing us the smallest signal that we could detect with a typical planar sensor made of these two parallel mirrors, and then each of these dots is a different one of these domed sensors. And what we see is that we can make these sensors more than a factor of 10 times more sensitive. Studies were then done to explore if this does in fact give us more imaging depth. So this was a series of absorbing tubes. So this is just a test object. Each of these is sort of a small tube filled with something that absorbs light, placed at a whole lot of different depths, down to depths of about 4 centimeters. Using a planar sensor, so a sort of typical sensor, we can see that the image recovers each of these tubes down to a depth of maybe 1.5 centimeters, maybe 2 centimeters on a good day. If we then compare that to the images that were taken using one of these domed sensors, we can see the tubes to a much greater depth. We can see that for the best one of these sensors that gives us the highest sensitivity, these tubes are visible all the way down to about 3 centimeters, so we've nearly doubled the depth of this imaging technique here. Perhaps even clearer in the three-dimensional view, where you can see the first couple of these tubes recorded using the planar system down to a depth of 1.5 centimeters, whereas we can get many more of them this way. So this is one way we might be able to improve imaging depth. And what's going on at the moment is trying to take these single sensors that we can do kind of proof of concept studies like this and make scalable arrays of them so that we can do fast imaging inside the human body, like the kinds of things I showed you earlier. Another frontier then is imaging resolution. So we want to get images where we can see smaller and smaller structures ever more clearly. We want to improve the imaging of photoacoustics. What can we do there then? So the best kind of ultrasound resolutions you can get are pretty small already. They're on the scale to maybe 20 on a really good day, more typically 50 micrometers. So something like a 20th of a millimeter. And the reason for that is that as you push the frequencies higher and higher, eventually you do start running into limits. We can't go for just higher and higher frequency ultrasound to get to smaller and smaller resolutions forever. One idea then might be, well, what if we went back to using lasers to do this? What if we focused a laser beam? These can be focused to much, much smaller regions, to 1,000th of a millimeter. What if we did that? Well, of course, the answer to that is I already gave you at the beginning. Human beings are not transparent, so we can't do this deep inside the human body. Have we got any other ideas? If we take this an unscattered beam, we've got this clear, small structure here. With conventional scattered light, if you put a light bulb behind a sheet of frosted glass, you can't really see anything. You just get this diffuse blur. But this isn't actually always the case with laser light. If we shine laser light through something that's very strongly scattering, we get this random, complicated thing called a speckle pattern, where we can see a whole load of randomly positioned bright and dark regions. So it's not immediately obvious how we can use this, but we have got some structure here. Unlike this condition, like you would get with incoherent light from something like a light bulb, with coherent laser light, we have got these tiny structures that we could try to use for imaging. And in fact, more than that, we have a thing called the angular memory effect. We can scan these speckles around under the right conditions by changing the angle of our laser beam on the scattering layer. So for example, if we took a layer of frosted glass and we scanned a laser beam around on it, it would produce this random speckle pattern on the other side. We wouldn't know what that is without putting a camera there, but we would know that we could move it around without distortion by scanning our laser. And we can use this for imaging. So as an example demonstration of this, we took this test object. So this is a series of really tiny, tiny numbers printed in a black ink onto a layer of plastic. So you can't see them here because the camera I used for this doesn't have nearly good enough resolution, but we've got tiny digits on the scale of about 50 microns, so about a 20th of a millimeter. We then hide that behind a layer of a scattering material to mimic what we would get in a tissue-like situation, and then we try to recover a photoacoustic image. If we do that, we can get an image, of course, like we would be able to get normally, but we can see this irregular array of dots, but we can't see what's inside that. We can't get the real detail of these digits. You know, if I take you a zoomed-in view, there's really nothing in here. This is just a blob. What we could do, though, is we could scan around that speckle pattern that I talked about earlier. We could change the angle of the laser on that scattering material, and we could look at how the strength of our photoacoustic signals changed. If we do that, we get a measurement that looks like this. So this is showing us how differences in the strength of the photoacoustic signal, what the strength of the photoacoustic signal changes as a function of two angles of this laser being scanned around. Now, I don't know if you can see from here, but this isn't just a blob. We have got some structure in there. It may not be obvious what structure we've got, what the image is. Some of you may be able to tell, I don't know. But to get this out reliably, what we need to do is we need a computational technique to recover this image. I'm not going to go into the detail of that here for interests of time, but if anyone's interested, I'm happy to chat about that more. But we're able to recover images at much higher resolution using this kind of measurement. So we've gone from having this blob where we can't really see anything to an image where you can very clearly see this digit 6. And we can repeat this process at each of those positions, and we get an image where the resolution is about 10 times better. So our resolution here is about 1/100th of a millimeter compared to about 1/10th of a millimeter that we started with. So this is one potential idea for increasing the resolution of photoacoustic imaging. There are some pretty big challenges in trying to take a technique like this and move it into the human body, but this is the kind of thing that we're exploring. So to summarize, I've talked about medical imaging and how contrast is really important for medical imaging. I've then described how colour is a really valuable source of contrast, how we can get lots of information out of colour, and how we leverage that in photoacoustic imaging by generating sound with light and using that to form these detailed three-dimensional images inside the human body of things like the blood vessels shown here. I've then talked to you a little bit about the technology required to make this technique work well, what kind of sensors we need in photoacoustics, how we need these to be highly sensitive, broadband, omnidirectional, small and scalable. And I've talked about these optical ultrasound sensors that we work on that allow us to meet all of these criteria. Finally, I've given you a little bit of a tour of some of the applications that are being explored in photoacoustic imaging, of assessing things like vascular diseases or the state of cancers. Finally, I've given you a little sampling of some of the research that's going on in this field in terms of imaging depth and resolution. So I'm finishing. I'd like to thank all of the people here from the University of College London and the University of Birmingham Photoacoustic Imaging groups, as well as a number of other colleagues that we occasionally work with, particularly the highlighted people here who contributed work directly to this presentation. Thank you for listening, and maybe we have some time for questions.